childhood neurodevelopmental disorders. KPLC's Kaylee Frith spoke with mental health professionals on what ADHD looks like in children and adults.
ADHD is often diagnosed in children who are either not paying enough attention or are paying too much attention. Common symptoms are difficulty staying focused on task or play, frequent daydreaming, forgetfulness in daily activities, fidgeting, excessive talking, interrupting others, and difficulty waiting their turn. ADHD is often connected to ADD, attention deficit disorder, but according to health experts we spoke with, ADD is an outdated term that was previously used to characterize inattentive and distractibility without the hyperactive and impulsive symptoms. But the current term ADHD encompasses both inattentive and hyperactive impulsive symptoms. Health professionals advise getting your child tested early on for ADHD.
So early intervention allows the child to continue to excel in their academic performance as well as social interactions. It also unmasks other things that may be going on. So as we talked about, a lot of the symptoms overlap. So if a child is having maybe anxiety or depression or maybe on the spectrum, those things can be evaluated.
The best opinion on whether your child needs to be tested for ADHD may come from their school teacher, who see them in a different environment than parents. In the United States, about 6.1 million children have been diagnosed with ADHD, which is around 9.4% of children aged 2 through 17 years old. ADHD, however, is not only in children and follows us into our adult years. It just sometimes looks different.
So the symptoms remain largely the same. They just kind of manifest differently. And we do see a decrease in the hyperactivities, right? So kids, we might see them running and jumping on things inappropriately. Obviously, adults, we don't see them doing that. And so the symptom of feeling really restless might still be there, but it's more of an internal feeling. It's more of this just like jittery feeling inside.
Health experts say ADHD needs to be treated just as any physical illness would be. Kaylee Frith, 7 News.
Common side effects of ADHD medications include decreased appetite, sleep disturbances, headaches, stomach aches, and increased heart rate or blood pressure. And health professionals advise patients to regularly monitor these side effects in order to minimize discomfort. Now let's head back over to Max for another look.